Podcast right after that. It's been a little slow.
It's kind of early. Well, not too early.
All right, team. Welcome to the MMOA podcast. Today with me, I have Emily Csepp, who's a physical therapist assistant, and super excited to be discussing with her this new technology for medication management. Um, and just to like give you a little bit of context, so I first met Emily at MMOA Live, which was
Mhm.
a super fun experience. We were in Kingman,
Yeah, Arizona.
Arizona.
No, um, yeah, Prescott, Cottonwood. We were in Cottonwood, Arizona.
Cottonwood, that's right. Okay. I
Yes,
went to
yes.
Kingman a year or so later. Um,
Okay.
yeah, absolutely. So we had a great time at the MMOA live course. I was cruising Instagram like you do and saw a really cool story about a new piece of technology for medication management. And just from my time in home health, man, I really like such an issue for so many of our patients who don't have a medical background. I think we tend to take that kind of thing for granted, just even some of the basics. But Emily, if you wouldn't mind, just tell us a little bit about yourself and where you treat, and then we'll get into a little more about just the medication management issue.
Yeah. Okay. So I'm a physical therapist assistant, and I have been for about 7.5 years. I've worked a lot of different settings. I did a stint of travel therapy, but currently I'm in home health in St. Louis, Missouri.
Excellent. Very
Yeah.
good. And so in your practice, your home health right now.
Yes. Yes.
So I'm curious, have you, what's your perception of this issue with medication management with older adults and
Yeah.
their outcomes?
Yes. So I think every therapist probably has some kind of story or many stories that come to mind with this issue. Just flipping the switch now being in home health, compared to a hospital setting where it's just given to them. I don't have to think about it. Now it's a lot more responsibility on, the therapist to make sure things are going smoothly. So, oh man, I just see everything from I walk in, there's pills on the ground. It's like, how old are these? When, like, I don't know when this happened. To just coming in like late in the afternoon with a high blood pressure and just asking, when did you take your blood pressure medicine? Oh, I haven't. And that was supposed to be my AM medicine. And so
Oh
just
gosh.
going through their pill box and, it kind of sets back your session because then you're calling the doctor if it's a super high reading and just trying to get things back on track to safely proceed with your session. So yeah,
Yeah.
definitely a big issue.
Yeah, it was such a big concern for me with so many of my patients in home health. I treated primarily
Mm-hmm.
in a rural area where just
Okay.
like medical IQ was super low. Um,
Yeah.
when I was doing my onboarding for home health, just to like drive that point home, because as PTs at the company I was working in, we would do start of care. So we were doing the initial
Mm,
medication management, getting
yeah.
all the interactions and everything. And just to like drive the point home, when I was riding with one of the RNs that had a lot of home health experience, she said that she had a patient who would get all of his medications and dump them into a bowl.
Oh
And when
my
he thought he
gosh.
needed something, he'd just pick something out. I
Just a
don't know if it was
candy.
I's favorite color, like
Oh
just
no.
absolutely absurd, but terrifying. Like it's it's comical on the surface, but the reality is like it's really playing Russian roulette with medication. It's really wild. The literature really backs that up. Because the reality is, I think sometimes, like, if you're listening to this podcast, you follow the Institute of Clinical Excellence, the MMOA division, we're all about like high intensity interval training and strength training and old,
Hmm.
not weak. But if you're doing all those wonderful interventions, but medication management is not dialed in, you're going to
Yeah.
have poor outcomes. So
Hmm.
even though it's something we tend to be a little bit uncomfortable with typically, unless
Yeah.
you have experience in home health or doing med recs, it can be a little uncomfortable, but it's very important for managing rehospitalization, long-term outcomes. I mean, even
Hmm.
early mortality, obviously, with the like
Yeah.
pill roulette guy. I mean, he
Yeah.
was really playing fast and loose. Um, so when I was cruising Instagram, I saw that Emily had shared a new piece of technology to help solve this problem. I'd love for you to share what it is and what your experience has been like with it.
Okay. So I walked into my patient's apartment and we were talking and, getting into things. And then I just hear this noise going off. And she was like, hold on, I got to take my pills. So she walked over and like started using this device. And immediately I was kind of like nerding out about it, asking her a bunch of questions that she had a pretty good, like mild cognitive impairment going on. So she couldn't answer a lot of questions, but she knew enough to go to the machine, take her pills, and then, get on with the rest of our session. So I did a deep dive into what it was and talked to the family. And so what it is, it's a smart pill dispenser.
Okay.
And how it works is that the family will set up the schedule and the medicines and load them all into the dispenser. I have heard it's a bit of a lengthy process to get started because you enter in each one and the name and the frequency and all of that. But after that, the machine just does the rest of the work. So whenever it is pill time, there will be an audible tone, a flashing lights, and then across the screen, it'll just start notifying the patient that it's time to take the pill. So they'll go over and push the button, and it won't dispense the pills unless there's the cup underneath it. So there has to be the cup underneath it for the pills to go in. And it'll dispense them one at a time. It does take a while. It's very slow. It just like rotates the pills and drops them in. So and then they take it and then put the cut back underneath. And so that part of it is so neat. But the other thing that I think is also really, really cool is that there's an app connected to it. So
Mm,
the caregivers can see in real time, they'll get the notification when it's pill time. They'll get a notification when they took the pill. There's also a notification that'll get sent if they miss their dose. I think it's after 15 minutes, they'll get that notification. They'll get a notification when the pills are low. So it kind of takes out the burden of the caregiver or family member having to come weekly to refill just like your traditional pill box. So
hmm.
it holds up in the dispenser up to 10 pills and a 90-day supply at a time.
Oh, wow.
Yeah,
And
yeah. So
what's
it's
it called
really cool.
again?
So this one is called Hero.
Okay, Hero.
So
So it
yeah,
sounds
yeah,
like lengthy process to get it set up. You've got to manually enter what the medication is. So I imagine there's
yes,
like a little container in it to put like this
yes,
medication, then one for the other, and you enter it. But then
yes.
with this smart technology, caregivers can be involved and know when the pills were dispensed. They could reach out to
Mm-hmm.
a loved one. Sounds like it
Yes,
doesn't dispense unless you put the cup in. Like this is pretty
yes.
cool.
It's really cool. And so you can also, the caregiver can dispense remotely. So I took that as like maybe like a PRN pain pill, which I thought was neat. I guess if the family
Huh.
member can communicate and say, I'm having some pain, they can remotely dispense anything. But I thought of a pain pill. So that I thought that was cool too, so that they're
Yeah.
not over under medicating them as far as pain goes.
Yeah, that's great. So
Yeah.
this client that you were serving, what
Hmm.
was her cognitive status?
So she was in independent living, but very much like doesn't really know exactly the time of day or the day that it is. So she could follow like our sessions pretty well. I think if she would have to manage her pills on her own, I don't think that would have she doesn't have the cognitive ability to know when to take her pills. So
Yeah, so even like with the schedule or alarms, like not gonna
yeah,
happen. So
yeah,
probably has some
even yeah,
form of mild cognitive impairment, but maybe not full-blown dementia diagnosis.
right, right,
Still responding
yes.
to the cue, knows what to do.
Yeah, she knew. She like right in the middle, we were talking. She's like, hold on, I have to take my pills. So it's a neat thing to keep people safe and healthy.
Yeah, that's super cool. So,
Hmm.
as far as like the payment side of things, like
Hmm.
how does a patient get a hold of one of these and
Yes.
what's the payment like?
Yeah, so they do not need anything from their doctor. Doesn't have to be prescribed or ordered through them. You can just go online on your own to the website and order. There is, I think, like a $99 like startup or initiation fee. But after that, it is purely a subscription service. So it's anywhere between $30 and $45 per month, depending on how much you want to pay like upfront or at one time.
Gotcha.
So yeah, it's just I guess between like $300 and $600.
For
And
the
to
year.
me, yeah, per year. Sorry, yes, per year.
Yeah.
Compared to if you have to transition them to assisted living, that's like thousands of dollars per month. Even bringing in some kind of a service to just administer pills a couple times a day. I think I don't know the price on those, but I can only imagine it's more expensive than $30 a month. So,
Yeah.
yeah,
If you think about being a caregiver for a loved one and you're having to like try to take breaks at work to go
yeah,
help make sure your loved one is getting their medications and like heaven forbid they've got to have them 3 times a day.
right,
It's not just like
right.
AM and PM.
Mm-hmm.
Not having that flexibility, but yeah, the cost of like paying someone to do that, and then it's like
Right, coming in.
the cost of someone you
Mm-hmm.
would trust to do that.
Exactly. Right.
Um,
Yeah.
I saw on the
Yeah.
website it was a super savvy way to think about it, but it's like basically like $1 a day
Yeah. Yeah.
on
You're
the low
exactly
end.
right. Yeah.
Yeah, so it's like, man, the
So
peace of mind and how that could help outcomes to prevent rehospitalization or proper function.
right.
I mean, even things like patients taking their Lasix at the wrong time. I
Yeah.
mean,
Yeah.
which sounds like a minor thing, but if you're up peeing your brains out all night, you're not getting good sleep, then you're groggy, then you don't have a good PT
Yeah.
session. And our patients who are really vulnerable and frail, it doesn't take a whole lot to throw them off. But then you start thinking
Mm-hmm.
about more vital medications like cardiac meds or
Yep.
antipsychotics, or like
Mm-hmm.
this could help prevent a lot of issues. I think this is just a really smart piece of technology. Just to be clear, we
Yeah.
don't get any endorsement from them
Right.
for our
Yeah.
for our podcast or anything, and nor does Emily.
Yep.
But man, just sounds like a really simple solution to a really big problem.
Yeah. Yeah. And just following up on the payment, I you can look into your like insurance policy, and I think that this device is covered somewhat under like a remote therapeutic monitoring, so it might be covered under certain insurances, but it's not just like flat right, like Medicare doesn't cover the whole thing or the subscription. I think it's
Yeah.
just a policy basis. So yeah, yeah.
Yeah, and that makes me think like it's probably not because on their website they put like Medicare eligible, but it's probably
Right.
like an Advantage plan or certain
Yeah.
Advantage plans, which we've got tons of
Hmm.
older adults, living home somewhat independently or in independent living or that may have
Yeah.
those plans. So
Hmm.
if cost is an issue, it sounds like there may be some help depending on your plan as well. But man, if you've got the resources
Right.
for something like that, and someone struggling with medication management. And I think this hits home for me too, because I watched
Hmm.
my mom, who was an RN, go fill pills for my grandmother, and then we had to
Yeah.
pay someone um, to go help make sure she actually took them when she was supposed to,
Right.
and help get ready for the day because there weren't like I grew up in a super rural area. There's no independent living or anything like that
Hmm.
in the
Hmm.
area, and
Yeah.
man, something like that would have been a game changer for her. So.
Yeah, and just like if medication management is the only thing like that will push people over the edge to need to move and displace them and totally change their quality of life to a new place and new people, like if this is the only thing holding them back, I just thought that this device is can be like a future amazing thing to continue to grow.
Yeah, absolutely. If we can keep people in their homes as long as possible, as independent as possible,
Hmm.
likely their outcomes are going to be better and saving them
Yeah.
from medication issues or rehospitalization. This sounds like this potentially could have a huge impact on a
Yeah.
lot of people for their outcomes.
Hmm. Yeah. Yep.
Man, Emily, anything else you can think of that you want to share about your experience with Hero or the applications of it?
Yeah, I just think that it's like a double-edged thing that in the home it's such like a neat new to me device, and on the other side just that family members and caregivers can monitor compliance from far away. It's just like the a double like win in my opinion. So yeah, I just thought it was so neat and happy to share more about it.
Yeah, absolutely. That is awesome. So, Emily, thank you for your
Yeah.
time. I'm going to share just a little bit about some of the stuff we've got going on here around MMOA. So, if you're looking to hop into a live course like where I met Emily, this incredible clinician leading the way in geriatrics, I'll be in Richmond, Virginia this weekend. We've got another faculty in North Dakota, and then June 1st and 2nd, we'll be in Scottsdale, Arizona. And then the weekend after, June 8th and 9th, we'll be in Houston, Texas. So if you're looking to see us live, we'd love to see you out on the road. You get to connect with cool clinicians like Emily to stay in touch and keep learning from each other, which is always a
Yes.
blast. Emily, thanks so much for your time. Thanks for
Yeah.
sharing about that technology. I have no doubt it's going to help a lot of clinicians better serve their patients. And yeah, just really appreciate your time.
Yeah, thank you. Yes, of
All
course.
right. Take care.